This taping provides support to the longitudinal arch of the foot. This tape can be applied to provide support as part of a treatment plan to manage injuries to the foot, lower leg, and knee. The required supplies include 1-inch adhesive tape and spray adherent. Like all taping procedures, you need to ensure that the skin is clean, dry, and healthy before the application. The foot should be placed in a near neutral anatomical position with the patient seated and ankle held at approximately 90 degrees. At the ball of the foot, apply 1 or 2 anchor strips from the base of the great toe across the bottom of the foot and end at the base of the small toe. Make sure not to apply a complete circular strip around the foot. Apply the supportive X pattern to the bottom of the foot. The support to the tape job comes from this repeated pattern. Begin at the bottom of the great toe on the anchor strip. Run a strip diagonally across the bottom of the foot and around the heel. End this strip at the base of the great toe on top of the foot. Apply the next strip from the bottom of the small toe and run a strip across the bottom of the foot and around the heel. End at the base of the small toe on top of the foot. Now make an X pattern starting at the base of the great toe on the anchor strip and ending at the base of the small toe on the anchor strip. These strips provide support toward the middle of the foot. These strips should be applied medially by overlapping 1/2 the width of the tape. Close the tape job by placing closure strips on the bottom of the foot, starting with a strip over the anchor. Work toward the heel, overlapping each closure by approximately 1/2 the width of the tape. Stop the closure strips as soon as you approach the heel. Do not cover the V formed by the diagonal strips. The closure strips should be pulled from the outside to the inside, lateral to medial, toward the instep. You may now cover the ends of the closure strips using a strip of 1.5-inch tape. Use care when removing the longitudinal arch taping. Use a Mueller tape and toughener remover, followed by washing with soap and water to ensure no residue is left behind. Turf toe taping. The turf toe taping is designed to prevent excessive hyperextension of the metatarsal phalangeal joint. Hard surfaces like artificial turf and shoes with a flexible forefoot such as tennis shoes often contribute to this injury. To complete the turf toe tape job, you'll need 1.5-inch and a 1-inch adhesive tape such as Mueller Perform or Mueller M tape. But this tape job is most effective when secured to the skin. You'll also need a spray adherent such as M-Tac, Mueller Quick Drying Adherent, or toughener spray. Position the athlete seated with the foot relaxed and the great toe in a neutral position. The athlete's great toe should be held straight and it should not be flexed at the IP joint. Shave any hair from top of the forefoot and the great toe. Apply the spray adherent. Begin by applying a 1-inch anchor around the great toe. Follow that with a 1.5-inch anchor to the midfoot area. Attach 1-inch overlapping strips from the great toe to the midfoot anchor. Work from the inside toward the outside of the great toe, overlapping each strip by 1/2. The number of strips will vary based on the size of the athlete. It is not uncommon to apply a turf toe tape job in advance to a standard ankle tape job. Possible variations to the turf toe tape job include using a 1 to 2 inch piece of stretch M tape to in a figure of 8 pattern around the great toe for additional support to the MP joint. It is not uncommon to apply a turf toe tape job in advance to a standard ankle tape job. Heel and lace pads. Heel and lace pads are used to prevent friction under a variety of adhesive taping techniques. The pads are made from very thin layers of foam combined with a dab of Mueller lubricating ointment. This protects the skin from friction and blisters around the heel and under the shoelaces. Ankle. The preventative ankle taping is designed to provide support to the lateral ankle. Since inversion ankle sprains are the most common, this taping is widely used in many settings. With practice, you should be able to tape quickly and efficiently. It's important to learn the proper steps of the preventative ankle tape job to apply it correctly. 1.5 or 2 inch adhesive tape, such as Mueller Perform or Mueller M tape, can be used. Wider tape is often used with larger athletes. 2 heel and lace pads made with a Mueller lubricating ointment and Mueller M-Wrap is applied to protect the skin. A spray adherent such as M-Tac, Mueller Quick Drying Adherent, or Toughener spray will provide the proper adhesive foundation. To begin, make certain the skin is clean, dry, and healthy. A shaved ankle will allow for greater adherence and therefore more protection. To begin, the athlete should be seated with the ankle placed at 90 degrees, as close to neutral as possible. Apply 1 heel and lace pad to the base of the Achilles tendon and 1 to the top of the ankle. Apply the Mueller M-Wrap by beginning at the foot and continuously apply the wrap to a point just above the ankle. How high up you place the Mueller M-Wrap is determined by whether or not you're anchoring the tape job to the skin. The preventative ankle taping begins with anchor strips. Apply 3 to 5 anchor strips on the lower leg. Begin at a point above the M-Wrap and work toward the ankle. Overlap each strip by 1/2. Angle the tape slightly so it doesn't wrinkle or gap in the back. Following the ankle preparation, pre-wrap application, and placement of the anchor strips, you will next apply the heel locks. Apply the lateral heel lock first. Start the tape on the outside or lateral malleolus. Pull the tape across the top of the foot toward the inside aspect of the foot. As the tape goes under the foot, angle the tape toward the medial side of the heel. Run the tape behind the heel and end the tape on the ankle joint line. Medial heel locks are applied in the opposite direction. Start the tape on the inside of the medial malleolus. Pull tape across the top of the foot toward the lateral edge of the heel. As the tape passes under the foot, begin to angle it toward the side of the heel. Pass the tape behind the heel and end the tape at the ankle joint. Anchor the stirrup from the medial or inside of the lower leg anchors to the lateral or outside anchor. The first stirrup should hit the posterior 1/3 of the medial malleoli as it passes. Give a slight tug just before lying down the tape on the lateral anchor. 2 or 3 stirrups will be applied depending on the size of the athlete. Stirrups are always applied medial to lateral in the preventative tape job. Each stirrup should overlap anterior the previous one by 1/2. When completed, the entire malleolus should be covered on each side. Following the stirrups, apply a second set of lateral and medial heel locks. We're almost done. Now apply circular strips around any open areas of the foot or lower leg to close the tape job and prevent openings or wrinkles, which may cause blisters. Gently squeeze the tape into place and give the foot a tap for good luck. Variations of the ankle tape job. There are several variations of the ankle tape job. One common variation is to use a strong elastic tape like Mueller Stretch M tape to apply extra support in the heel lock or stirrups. This added protection can be helpful if using the tape procedure following an injury. Ankle tape removal. Removing the tape requires some care and a few supplies. A Mueller M cutter and a small amount of lubricating ointment will help make this an easy task. Place a dab of ointment on the flat end of the M cutter. Carefully start at the bottom of the tape job along the instep. Slide the cutter behind the medial malleolus ankle bone and up to the end of the tape job. This can also be performed in the opposite direction. Remember, it's always easier to cut the tape off along the instep. Peel the tape from the skin with care. Use an adhesive remover if needed, and always clean the skin with warm soapy water after tape removal. Ankle compression wrap. The ankle compression wrap is the first of several compression wrap techniques presented in this program. Elastic compression wraps are used to provide mild support compression following muscle injury, help control swelling following injury to a joint, secure padding, and secure ice packs. Some general guidelines for their use include: always apply the wrap from distal to proximal. Try to center the injury site in the middle of the wrap. Never allow your athlete to wear the wrap overnight without loosening it first. Always check circulation after the wrap has been applied. Secure the wrap with elastic tape. Metal clips are not sufficient for active use. The use of an ankle compression pad and wrap combined with elevation is an effective strategy to combat swelling. To apply this technique, you'll need an elastic wrap and some felt or closed foam. Cut the pad to the desired size based on the size of your patient. Cut a hole in the felt to allow for the malleolus. Place the compression pad over the lateral aspect of the ankle, if, for example, you're treating an inversion sprain. Apply the wrap from distal to proximal, toes toward the heart. Leave the toes exposed. This allows you to check the circulation. Be sure to cover the entire foot and ankle with even pressure. Extend the wrap up to the calf musculature, secure with some Lite tape and 1.5-inch M tape. Ankle braces. Mueller Sport Care offers a wide variety of ankle braces to meet the needs of active people. These braces are intended to provide comfort and support and protect the ankle from sprains. One advantage of bracing over taping is the athlete's ability to apply the brace themselves. Examples of Mueller braces include lace-up models like the Mueller ATF ankle brace and hinged models, popular with volleyball and court sport athletes who need to jump freely. ATF ankle braces feature a patented inner ATF strap to support the most commonly sprained ligament to protect from inversion sprains. The high-performance ATF is a custom-fitted left or right brace that conforms to the arch of the foot for precise fit based on the athlete's shoe size. Ankle braces. Mueller Sport Care offers a wide variety of ankle braces to meet the needs of active people. These braces are intended to provide comfort and support and protect the ankle from sprains. One advantage of bracing over taping is the athlete's ability to apply the brace themselves. Examples of Mueller braces include lace-up models like the Mueller ATF ankle brace and hinged models, popular with volleyball and court sport athletes who need to jump freely. Mueller Lite hinged ankle brace is extremely lightweight and comfortable. This hinged brace provides protection against inversion injuries. It features one strap for easy on and off and fits in any style shoe. Achilles tendon. The Achilles tendon taping provides support for the Achilles tendon by limiting extreme dorsiflexion of the ankle. You will need some spray adherents, heel and lace pads, Mueller M-Wrap, 1.5-inch tape, and Mueller Tear Lite tape. Apply the adherents, heel and lace pads, and Mueller M-Wrap from the midfoot to the base of the calf. Use 3-inch stretch M tape to fix the anchors to the calf and foot. This tape job must be adhered to the skin to be effective. After the anchors are in place, have the athlete point their toes. Measure a length of 3-inch elastic tape from the proximal anchor to the distal anchor. Trim any excess tape as needed. Repeat the above procedure and split the tape in the middle or the distal end. Secure the tape as shown around the midfoot. Pull the ankle to 90 degrees and apply Mueller Tear Lite tape over the entire tape job. Secure with 1.5-inch adhesive tape. Knee taping. Taping of the knee is not a common practice for the athletic trainer. As a rule, the use of knee braces coupled with the ineffectiveness of most tape jobs to this joint have made taping the knee almost obsolete. There are two exceptions to this rule: taping of the patella to affect patellar tracking, which is beyond the scope of this program, and taping of the MCL, medial collateral ligament. The MCL protects the knee from valgus forces, for example, when someone lands on the outside of the knee, and also assists in preventing anterior movement of your tibia on the femur. This taping procedure should only be applied to provide additional protection to an athlete who has fully rehabilitated and has been provided clearance to participate from a sports medicine physician. Place the athlete standing or seated with the knee flexed approximately 15 degrees. The hip will also be in a slightly flexed position. If standing, use of a heel lift will help position the athlete properly. The skin must be dry, clean, shaven, and healthy. This procedure tape job must be anchored to the skin to be effective. Apply the spray adherent to the knee and leg and place 2 heel and lace pads behind the knee will prevent irritation in this area. Apply MWrap to cover the upper third of the calf, knee, and lower third of the thigh. Use 3-inch Mueller stretch M tape to provide anchors at the mid-calf and mid-thigh. Apply 2 anchors overlapping by half the width. Using 1.5 or 2-inch adhesive tape, apply an X pattern over the MCL ligament. Be careful to stay 1 finger width away from the patella. Apply 2 or 3 X patterns depending on the size of your athlete. Now apply an X pattern using the stretch M tape. Once completed, secure the elastic tape with 2-inch adhesive tape. Be careful not to use constrictive adhesive tape all the way around the muscle. Use half strips to prevent excessive constriction. Cover the entire tape job with M-lastic tape and secure the ends with adhesive tape. Knee compression wrap. Following an injury that causes swelling in the knee joint, it's important to aid the patient in the control and removal of this fluid. A compression wrap applied using our proximal to distal crisscrossing pattern and secured using flexible tape will assist in this process. Our general guidelines still apply. Always apply the wrap from distal to proximal. Never allow your athlete to wear the wrap overnight without loosening it first. Always check circulation after the wrap has been applied, and secure the wrap with elastic tape. Knee braces and supports. Knee braces and supports can be used in many ways to provide comfort and protection to your patients. From the simple warmth and compression of a basic knee sleeve to the protection of a hinged brace, knowing the underlying problem and selecting the correct brace is the key to successful care. Proper fit is essential. The most accurate fit can be obtained by measuring the circumference at the center of the knee and selecting the proper size. Adjustable knee supports. This one-size-fits-most support with adjustable tension straps gives your knee a custom fit. Patented strapping system provides maximum compression and stability. The Neoprene blend retains body heat for increased circulation to relieve pain, promote healing, and keep joints flexible. It's lightweight and comfortable for all-day wear. The open patella prevents slippage while keeping the kneecap in place. Adjustable straps provide custom fit for controlled compression. The design minimizes bunching behind the knee. Hinged knee brace. This brace provided support and protection. Bilateral hinges restrict medial and lateral movement and help control flexion and extension of the knee. The universal buttress, made of rubber tubing, encircles the kneecap to apply pressure for support of the patella. Extra padding above and below the patella buttress provides added protection and greater therapeutic heat to the area. Opposing adjustable front and back straps hold the brace in place. Patella Stabilizer Knee Brace. Designed to provide knee support with a comfortable fit, this brace helps stabilize the patella. Supportive steel springs on both sides of the knee provide support without limiting movement. The patellar buttress helps protect the patella during activity or while recovering from an injury. Opposing adjustable front straps hold the brace in place. Patellar strap, jumper's knee strap. The jumper's knee strap is designed to improve patellar tracking and elevation by applying mild pressure on the tendon below the kneecap. This helps reduce the effects caused by frequent running and jumping and provides relief from patellar tendonitis and chondromalacia. Knee sleeve and knee sleeve with open patella. The Neoprene blend knee sleeves provide even compression and warmth to the knee. The stretch design allows them to slide on and off with ease. The open patella is commonly used to provide relief from pressure on the kneecap. While providing only minimal protection, knee sleeves are used frequently to aid in treatment of chronic conditions that respond favorably to compression and warmth. Thigh wrap. The quadriceps and hamstring muscle groups are commonly injured during athletic activities. The application of an elastic wrap to provide compression in the early stages of treatment is a frequent practice. The application of the wrap follows some general rules. Always apply the wrap from distal to proximal. Use a crisscross pattern to allow the wrap to stay in place, and use flexible tape like Mueller tear Lite around the muscle belly. Thigh sleeve. A thigh sleeve can be an excellent device to provide warmth and compression to the hamstrings or quadricep muscle groups following injury. The thigh sleeve is easily applied, and proper fit is determined by measuring the circumference around the mid-thigh. Hip Spica. Supportive wraps for the groin and hip flexors are variations of the hip spica. They both follow the spica pattern of applying a wrap around an extremity followed by a wrap around the trunk or waist. The purpose of these wraps is to provide support to the muscles of the groin and hip region. To apply the groin wrap, position the patient with their knees slightly flexed, hip internally rotated, and weight in the opposite extremity. Secure the wrap around the thigh starting lateral and working medial, outside to inside. Go around the waist and place tension on the wrap as you bring the wrap back downward around the extremity to help support the adductor muscles. Continue this pattern until you run out of wrap, making sure to end around the thigh and not the waist. Secure the wrap with a flexible tape like Mueller tear Lite and cover with 1.5-inch adhesive. Use caution not to wrap too tightly around the muscle belly. Hip Spica. Supportive wraps for the groin and hip flexors are variations of the hip spica. They both follow the spica pattern of applying a wrap around an extremity followed by a wrap around the trunk or waist. The purpose of these wraps is to provide support to the muscles of the groin and hip region. To apply the hip flexor wrap, position the patient with their knee and hip slightly flexed and weight in the opposite extremity. Secure the wrap around the extremity, starting medial and working lateral, inside to outside. Place tension on the wrap as you pull up to support the hip flexor. Go around the waist and then back down around the extremity. Continue this pattern until you run out of wrap, making sure to end around the thigh and not the waist. Secure the wrap with a flexible tape like Mueller Lite covered with 1.5-inch adhesive. Again, use caution not to wrap too tightly around the muscle belly. Lumbar supports. Occasional back pain is an unfortunate reality for most active people. Proper application of the Mueller Sport Care products shown in this section can help provide support and comfort for temporary low back pain, as well as play a role in assisting patients who are undergoing treatment and therapy for more serious problems. Lumbar back brace with removable pad. This lumbar brace features a double layer design that allows for a custom fit and adjustable compression to the abdomen and lower back. The removable lumbar pad cushions and compresses the lower back for concentrated support. Extra stability is provided by stainless steel supports along the spine. The breathable fabric allows for patient comfort. Back brace with steel springs. This back brace is an adjustable, lightweight, and comfortable brace with 8 flexible steel springs for support of lower back area. It has a contoured 9-inch wide elastic band with outer 4-inch band and front fasteners. This brace can be worn under or over clothing. Shoulder spica. Like all spica patterns, the shoulder spica follows similar rules, applying a wrap around an extremity followed by a wrap around the trunk. The shoulder spica is an effective method for providing gentle compression to the AC joint, securing protective pads, and holding ice bags in place. The application follows our familiar spica pattern. Start wrap around extremity. Reach across the chest or behind the torso. Finish the wrap and secure around the upper arm. Notice the X pattern formed by the spica technique over the AC joint. Elbow taping for hyperextension. The purpose of the hyperextension tape job for the elbow is to limit full extension of the elbow joint and thus protect the injured tissues. This taping must be anchored to the skin to be effective. To apply this technique, you'll need M-Wrap, Stretch M tape, 1.5-inch adhesive tape such as Mueller M tape or Mueller Perform tape, M-Lastic tape, and spray adherents. The skin must be clean, dry, and healthy. If needed, shave at the upper and lower arm to allow for proper anchoring of the tape job. Position the athlete in a seated position with the elbow held in slight flexion. Have athlete make a fist to contract the biceps muscle. This prevents excessive constriction from the tape. Apply anchor strips around the biceps and forearm using Stretch M tape. Make a bridge or check rein out of 1.5-inch overlapped tape. This can be made from either adhesive tape or stretch tape. Attach the check rein or bridge using 1.5-inch tape at each anchor strip. Secure with Stretch M tape. Once the tape job is secure, use M-lastic tape or Mueller Tear Lite tape to cover the entire tape job. Secure with 1.5-inch adhesive. Elbow compression wrap. Following an injury that causes swelling in the elbow, it's important to provide compression to help remove this fluid. A compression wrap applied using our proximal to distal crisscrossing pattern and secured using flexible tape will assist in this process. Our general guidelines still apply. Always apply the wrap from distal to proximal. Never allow your athlete to wear the wrap overnight without loosening it first. Always check circulation after the wrap has been applied. Secure the wrap with elastic tape. Elbow sleeve. The Neoprene blend elbow sleeves can be used to protect the elbow from abrasions, provide mild compression, and gentle warmth to the elbow joint. Proper sizing for the elbow sleeve is determined by measuring the circumference around the center of the elbow. Tennis elbow brace. Tennis elbow or lateral epicondylitis is a common injury among racket sport athletes, bowlers, golfers, and anyone who places strain on the forearm muscles. This adjustable support provides compression to help relieve elbow pain. Wrist. There are several variations of taping for the wrist. The purpose of these tape jobs is to provide support and limit motion to protect the wrist joint. 1 and 1.5 inch adhesive tape and Mueller M-Wrap are the supplies needed to provide support at the wrist joint. To tape the wrist, have the athlete hold the hand out with the finger spread. Use circular strips to provide the desired level of support to the wrist joint. Thumb. The purpose of the thumb tape job is to support the collateral ligaments of the MCP joint. Injuries to the thumb should be taken very seriously, since it allows for all fine motor and grasping activities. To tape the thumb, position the patient in a handshake position with the thumb up and fingers spread. Apply Mueller M-Wrap to cover the thumb and wrist. Use a figure of 8 pattern to secure the base of the thumb and the wrist. Apply standard wrist tape job to secure the thumb taping. There are several variations of this tape job. The video demonstrates a closure procedure to apply extra support to the MCP joint. Fingers. Fingers are most often taped to provide support to the adjacent finger, provide compression to a single digit, or to provide support to a joint within the finger. Using Mueller M-Tape and Stretch M-Tape, several variations are possible. Use caution when applying the buddy tape job. Always tape the second and third or fourth and fifth digits together. This avoids leaving a single digit at risk. Ankle ice wrap. Applying ice post-injury is a common practice. Mueller cold packs, Mueller reusable cold packs, and Easy Wrap make this an easy procedure. Instant cold packs, like Mueller cold packs, are a convenient alternative when no ice is available. Simply squeeze and shake the pack and apply it using a towel or protective cloth. Proper removal of gloves. When dealing with wounds and wound care, basic first aid and universal precautions are discussed widely. However, just wearing your gloves to protect yourself and your patient is not enough. You must remove them in the proper fashion. Gloves should be removed in a manner that prohibits contact with the contaminated surface of the glove. This means that your hands should never come in contact with the outer, dirty surfaces of the gloves. This can be accomplished by following these steps. Grab the first glove on the outer surface at the wrist. Pull the glove back onto itself so that when it is completely removed, it will be inside out. Remove the other glove by slipping your bare fingers inside the glove and pulling it off so that it's also inside out when completely removed.